Bismillahirrahmanirrahim. Assalamu alaikum. I welcome all the audience from different parts of the world to the Imamia Medics International Women's Wing webinar. This webinar is also part of our health and wellness series that has been going on for several years now. And today's particular episode has something for you to be prepared for the upcoming month of Ramadan. Without any delay, we will begin today's session with the recitation of holy verses. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد. Translation. In the name of Allah, the Merciful, the Compassionate. Say, He is Allah, the One and Unique. Allah, who is in need of none, and of whom all are in need. He neither begot any, nor was he begotten, and none is comparable to him. Sadaqallahul Azim. Once again, I welcome everyone who is watching us from different parts of the world on the YouTube page of Imamia Medics International, also known as MyTV. I would like to mention that our audience can put up their question in the comment section while our speaker shares her wisdom with you all, and we can take your questions towards the end of the session and would, inshallah, request our speaker to address that. I would now like to introduce our esteemed speaker and guest for today, that is Dr. Wahida Karamlly. Dr. Wahida Karamlly earned her Doctor of Public Health in Health Policy and Management from the Columbia's University Mailman School of Public Health. She is a diabetes educator and a diplomat of the ACCL, clinical lipid specialist, and is recognized as Fellow of the National Lipid Association. She is currently an associate editor for the Journal of Clinical Lipidology since 2015, and prior to her retirement, she was the director of the Bionutrition Core in the Irving Institute for Clinical and Translational Research at Columbia University for over 30 years. She has published in peer-reviewed journals and textbooks, and she has served on the board of directors of the American Diabetes Association, Asia Pacific Diabetes Action Control, Northeast Lipid Association, Accreditation Council for Clinical Lipidology, New York Heart Association. She was also recognized as one of the 100 Muslim women from India in Rising Beyond the Ceiling. And Dr. Wahida Karamlly has been associated with the Imamia Medics International Women's Wing for a very long period of time. She has also chaired the Stay Healthy group of the Women's Wing, and she has done a lot of work for the humanity, being associated with us and also in general. I would like to welcome our esteemed guest for today, Dr. Wahida. You are welcome. Thank you for joining us.
Thank you so much, Dr. Varda. I'd like to thank Dr. Huma Naqvi, who is really the inspiration behind all this, workshops that go on through IMI. So thank you, Dr. Naqvi. So we begin by planning for Ramadan. It's a month when we have to think about our health, and more importantly, how can we improve the health of our families. It's also February's heart month, so I hope all of you are wearing red. And so let's move on and do it together. I can't move the slide.
So can you try to press one of the arrow keys, please?
It's not moving.
I would request if you can try to press the escape key once, please.
I'm not able to do that. I think it's the same issue as we experienced a little while ago.
Right. So can I request you to try to reshare the screen, please?
So I have to stop share now.
Yes. And pressing the share button again.
I don't see the share button. Okay.
Do you see it now?
Yeah.
Yeah, we can see your screen now.
So food has a great significance in Islam. It's associated with one's relationship with Allah. The Quran says, "Eat of the good and wholesome things that we have provided for your sustenance, but indulge in no excess therein." And I think that's really so important for us to remember, that we don't indulge in excessive intake. So Islam thus creates a sense of responsibility in people to take a healthy living lifestyle as normal. Fasting in the month of Ramadan teaches to manage and practice spirituality and not to eat excessively. So, the essential part of spirituality in food is that we are grateful and thankful for the food we get. So, when we look at how do we eat, we have several studies that have looked at the efficacy of the Mediterranean diet, the picture on top, and also the DASH diet, which is the dietary approaches to stop hypertension. And if you look at both these pictures, there's a there's a lot of emphasis on eating lots of different colored vegetables and fruits, whole grains, using legumes, using plant-based proteins, and eating fish and small amounts of poultry. And the source of oil should be the olive oil, the extra virgin olive oil that's always used in the Mediterranean regions. And if you look at the dietary guidelines that are given to Americans every 5 years, after a lot of research looking at the evidence, what's really good for people at different ages, it says the latest guidelines say follow a healthy dietary pattern at every life stage. So we have to think of our children, what they're eating, and what's going to help them to grow into healthy people. It's also important to understand that food, has to reflect personal preference and also cultural tradition. So we cannot get away from that. And the American guidelines do cater to all kinds of people, because we are a salad bowl of different ethnic groups, different religions coming from different countries. And of course, there are budgetary considerations, considering with the inflation these days, we can buy very little food with the money we have. So it's really important to know how to select nutrient dense foods so that we can all benefit by whatever we buy in the supermarket. And it's also important to look at what's on your plate, making sure we have enough different colored vegetables. That should be the center of your plate. And also to make sure you're using legumes, which are less expensive than eating meat. So we can go to having different kinds of dals, all the different lentils, chickpeas, etc., kidney beans, a lot of things that we can include in our diet to get adequate protein. And of course, we have to limit foods that are high in sugar, also foods that are high in saturated fat, and also those that are high in salt, sodium. So we have also research to suggest that when you adhere to the Mediterranean dietary pattern, it's associated with reductions in coronary heart disease by 29 to 69%, and the reduction of the risk of stroke by 13 to 53%, which is very significant. And there are also studies to show when we adhere to the Mediterranean diet, there is a 20 to 23% reduced risk of developing type 2 diabetes. And also the randomized controlled trials, which are the gold standard of conducting research, show that the Mediterranean diet will lower the glycosylated hemoglobin levels, which is the hemoglobin A1C, by 0.3 to 0.47%. And that's associated with almost 30% reduction in cardiovascular events. So when a person has diabetes, it doubles the risk for heart disease in men, and it quadruples the risk of heart disease in women. So women are at a higher risk when they have diabetes. So there are a lot of cardiometabolic benefits in type 2 diabetes. And the reason being because the Mediterranean diet has so many vegetables and different colored fruits, it has an anti-inflammatory effect and also an antioxidative effect because you're not using so much polyunsaturated fat, which is like found in corn oil and soybean oil. So we have to eat less of the polyunsaturated, get more of the monounsaturated, like in olive oil, and also have less of the saturated fat that you find in butter and ghee and coconut oil and palm oil. So this will improve insulin sensitivity in the peripheral tissues and also improve endothelial function and cardiometabolic health. So, healthy eating can promote health and reduce the risk of chronic disease starting from the time the baby is born. There are a lot of issues with having iron deficiency in babies, and also they can have an issue with gaining too much weight. And they could be also, eating healthfully will also lower the risk of peanut allergy. This is what they have found. Uh, when the child is getting older to become an adolescent, also have to make sure that they're not gaining too much weight. There's a lot of obesity in children in the United States, and this is what we have to look for. Even if you go to the mosque, your local mosque, look around. There are a lot of children who shouldn't be so heavy, and because they are probably eating all the wrong foods and eating a lot of cookies and candy, etc. And also in children, you can have high levels of the bad cholesterol, the low density lipoprotein cholesterol, because they're eating so much saturated fat. And then we have women, it's important that women are also given the right kinds of foods, particularly when they are pregnant, because that will have a favorable effect in the child. And also to make sure that they're getting enough folic acid to prevent any complications during pregnancy. As we grow older, you'll find among your parents, your grandparents, or even yourselves, if you're in that age group, you'll have more of those, risk factors like high blood pressure, high cholesterol levels. So high also may have type 2 diabetes. So if you eat healthfully, there are a lot of benefits by lowering the risk factors, including heart disease and diabetes. So Ramadan is the month to begin thinking about our health. And I'm glad we're doing it in February because you can start planning for Ramadan and what you need to plan for your iftars, for yourselves, your family, your friends, etc. And think about the risk factors people have, including smoking. Think of eating patterns. How can we improve them? Because we probably be too tired to cook. How can we plan ahead? And think of physical activity because it is limited during Ramadan, but then how can you be more physically active? So need to reset for Ramadan. It's particularly when a person has diabetes, it becomes a challenge not just for the patient but also to the physician, your nurse practitioner, whoever you're seeking health information from. So what's important to remember is, you know, the way you manage diabetes during Ramadan should be no different from other times of the year. And it's the important thing is to control symptoms, the glycemic management, which is diabetes management, and also prevent any acute complications. There could be a problem of low blood glucose, hypoglycemia, and also it's important to manage the comorbidities. If you have problems with cholesterol or triglycerides, and or being overweight, you need to also manage those comorbidities. So it's really important that a person who has diabetes should seek a doctor's help at least 2 to 3 months prior to Ramadan. And hopefully, those of you who have diabetes have already discussed it with the physicians, uh, to describe your previous Ramadan experience. How did you manage your diabetes? Did you have any problems with low blood glucose, particularly if your blood glucose goes under 70 milligrams per deciliter? That's the time you cannot afford to not do anything. You'll have to break your fast because it can be very dangerous. So, when we plan education programs for patients with diabetes, we have to look at, what are the risks the patient has. We have to check whether they're doing blood glucose monitoring. It's okay to prick yourself during Ramadan to get a drop of blood to make sure what your blood glucose levels are. Make sure that you have managed your fluids and your diet for the day when you're not going to be eating, and understand when to break the fast when it becomes dangerous, when your blood glucose is very high, or when it's very low, under 70 or over 300. You need to break your fast, and the doctor will help you to adjust your medications. If you're on insulin, also to adjust insulin so that you can manage diabetes and keep your blood glucoses under control during your fasting period. And of course, to talk about what exercise you can do to keep fit. So the doctor will plan with you, as I said, particularly the medication adjustments. If you're seeing a nutritionist, he or she will plan the diet for you so that you know what to eat for suhoor and what to eat for iftar, so you don't have these excursions in blood glucose management. So we have studies to show that there is definitely a benefit when you go through an education program in terms of managing your diabetes and reducing your risk for low blood sugar episodes. There are about 150 million Muslims with diabetes worldwide, so that's a huge issue that we need to discuss all over the world so that people who have diabetes can have a healthy outcome even during Ramadan. So, as I said already, there is the patient education will include, not just the medication adjustments, but also a diet that can be helpful and also lower your comorbidities. So there's research to show that there is a risk in diabetes of hypoglycemia, particularly hyperglycemia, diabetic ketoacidosis, also dehydration and thrombosis, forming of clots. The studies have shown that there is a huge increase in the incidence of severe hypoglycemia in both patients who have type 1 diabetes as well as type 2 diabetes compared to non-Ramadan periods. There are tons of studies on Ramadan, but these are not controlled clinical trials because it's difficult to get people who are not fasting versus fasting. So there are a lot of observational studies that show that some people lose weight, some people don't lose weight. And particularly people who lose weight may not be able to keep it up 2 months after Ramadan, because you start eating again. And also the iftar is very important because that itself, if you're going to be feasting, then it also carries risk for those with diabetes because you're going to have very high blood glucose levels and it'll be difficult to manage it throughout the night. So we need to understand risk factors, your eating patterns, as well as your physical activity. And also when there's a shift in meal times and sleep patterns, these cause fluctuations in your endocrine and homeostatic processes. So the Ramadan fast can even last 20 hours. It could be 17 to 20 hours. It's a form of an intermittent fast. And we know, we practice it for 29 to 30 days, but there are people who begin to fast before Ramadan starts and continue to fast in Shawwal as well. So as I said, the weight changes are variable, and it all depends on the individual. So I would be most concerned about, severe hypoglycemia after each of the meals, as well as hypoglycemia, dehydration, and there could be significant weight gain due to increased calorie intake and reduced physical activity. Also, there could be acute renal failure in patients prone to severe dehydration, particularly in the elderly people and those who have impaired kidney function. So when you look at your plate, there's no one size that can fit everybody. You have to look at all your risk factors that you have, and manage that as well in terms of what you need to be careful about in terms of restrictions. And as I said, think of the DASH diet or the Mediterranean diet and how to plan your iftar table, thinking of the different colors that you have to bring into on your table so that people can enjoy the food that you provide them as well. So when you think of risk factors like high blood pressure, lipid abnormalities, dyslipidemia, you have to be careful too. Some people say, oh, why should I worry during Ramadan? It's only 1 month. You do have to worry because we have done studies to show that your cholesterol, depending on how you eat, can either go up or go down within 4 weeks. And we have tested that, and we have shown that you do have to continue to eat in a healthy way to prevent an increase in your LDL cholesterol, which is a bad cholesterol, as well as the triglycerides, which is another risk factor for heart disease. And people don't seem to pay attention to that. And if your triglycerides are over 150 milligrams per deciliter, it increases your risk. And there are some people who cannot tolerate fat at all. So they have what's called familial chylomicronemia, and they can, just eating fat they can end up in the emergency room because of an attack of pancreatitis. So you have to be really very careful. And then there's one thing that you can really watch for yourself is measuring your waist circumference. And we know now that the waist circumference for South Asians is lower, as well as all Asians, including Chinese and Koreans and Japanese. We have lower cut points. We cannot have the same cut points as Americans. So we have to be very mindful that we are controlling our waist circumference. You'll find a lot of people who look kind of slim, but they have pot bellies, and that increases their risk for heart disease, diabetes. So the truncal fat is very important, and that's why waist circumference is something that you can do in privately and just have these measurements for yourselves and feel good when you're managing your waist circumference. So again, just to emphasize that the diets that you're consuming, even during Ramadan, should have lots of vegetables, have fruits, but not fruit juices. Eat the whole fruit, whole grains, chicken, not too much, fish, nuts, unsalted nuts, and low fat dairy products. So even if you're making a raita, look for non fat yogurt. You don't have to have a full fat yogurt. If you're going to provide milk for tea and coffee, I know a lot of people buy the canned milk. Buy the non fat milk, it tastes just as fine. So there are a lot of little things that we can do to improve. A lot of times you will see the iftar table meats, like a couple of meats, and overcooked vegetables, like 2 inches of oil floating on the trays, hardly, and then the salad is usually like um, a lettuce, iceberg lettuce just chopped up. So there are ways of making it more interesting, more healthful, using dark green vegetables, using a variety of vegetables in your salad bowl, using a dressing made with extra virgin olive oil, using flavors to add to it. So there are ways that you can. There's no reason to provide two meat dishes. You can use um, um, delicious dals made and provide them, have more vegetables. Also, there's no reason to buy fresh vegetables when you don't have time to clean and cut. You can buy frozen. In fact, frozen vegetables have more nutrients locked in because of the facilities for freezing are close to farms. They don't sit in warehouses like when we buy fresh vegetables. They're sitting in warehouses for a long time before we buy them. So it's really good to buy even frozen. They're all cleaned, they're ready to cook. You can make them roasted. And you use different flavors like za'atar, harissa. That brings a lot of excitement to the palate, and people will enjoy it. So here are some ideas. We don't have to have chicken makhani. You can use plant-based, as I said, make different dals coming from different areas. Maybe you have different recipes that you can use with a lot of vegetables in it. Uh, Using nuts, using almond flour is also another wonderful way of increasing protein and other nutrients like magnesium, which is deficient in our diets, potassium. Um, you know, again, we know that plant-based diets reduce the risk of severe chronic diseases. So we can, have a bunch of different legumes. In fact, actually, I practice what I preach. In the center, you see the plate with the chickpeas and spinach. That's what we eat and enjoy it. And then you can have a whole bunch of dairy. You can make lassis with it. You can make desserts with it, non-fat. You can make raitas with it. So there's something for you to think about how you can lower your intake of saturated fat. So for desserts, again, fruits and nuts, it's a great fusion, and that can be served as a dessert rather than having canned sweetened fruit mixed with heavy cream. And this is also what I frequently see in iftar served in the mosques. So, what do we do in terms of the distribution of different macronutrients like carbohydrates, proteins, and fats? So, it's really important, as I spoke about nutrient dense foods, to include those, um, and then distribute your carbohydrate, because all the carbohydrates, the bread, the pastas, the fruit, they all turn into sugar, and that has an effect on your blood sugar levels. So it's really important to distribute the carbohydrate between suhoor and iftar so that you don't have too much at one given time. Also, as I said again, make sure the food is not very salty. You're not having too much caffeine, because then there's a risk of uh, dehydration during the day. So what we suggest is, with the carbohydrate calories, there are 4 calories per gram of carbohydrate. If you eat one slice of bread, that can give you 15 to 20 grams of carbohydrate. So it's very important to look at what you're eating and how you're distributing it on your plate. And you can have chicken without the skin, or you can have plant-based protein as well, which means including um, the nuts and the dals and the different lentils. And include the high fiber foods, which come from all the different vegetables, the whole grain bread or brown rice. And even if you use white rice, add the vegetables to it. You can add a lot of vegetables to rice to make it interesting as well, like a vegetable pilau made with olive oil and all the flavors that you like to add to it. And make sure you stay hydrated between iftar and suhoor. You drink a lot of water, unsweetened beverages. So when you think of nutrient density, here's a pound of spinach, which gives you 110 calories, and here's a pound of pound cake, which gives you almost 2,000 calories. So this is where you make your decisions. Um, so as I've already said, eat more fresh fruit, serve more fresh fruit, use small amounts of oil, because oil fat is high in calories. 1 gram of fat is 9 calories. Avoid the caffeinated and sweetened drinks, juices. Avoid salty foods. And also, you don't have to do deep fat frying. You can saute foods, you can roast them, just drizzle a little bit of oil and roast the vegetables, and use your flavors, whatever you like. If you want to use spices that you're used to, add those spices to those vegetables. And keep away from coconut oil and ghee and butter. Use instead the olive oil. And olive oil is okay for cooking. A lot of people have this misconception that I shouldn't be using olive oil, as long as no oil should be heated at very high temperatures, because you can oxidize fats. So it's good to do sauteing without doing deep fat frying. So this is the way you measure your waist circumference, and all you need is a measuring tape, and which will give you some immediate feedback. So that, as I said, the cut points are much lower for us South Asians. So rigorous exercise is not recommended, but you can certainly do some light to moderate exercise during Ramadan. It's better to do it little before iftar or after iftar, but not during the day. So usually you see this, people having fried food, and actually I've seen a person sitting with a large bottle of Coke and lots of samosas for the iftar appetizer. So just be mindful of that. There are a lot of calories in these fried foods. If you're going to eat 400 calories in samosas itself, you have to walk 4 miles to burn those calories. And do you know how many teaspoons of sugar in 12 ounces of Coke? Well, it's 10 teaspoons of sugar. So just be mindful of that as well. So think of health span. We all think of life expectancy, lifespan. That's not so important, because you need quality of life. Whatever life we are destined to live, we have to live with a good quality of life. So a health span is really, think in terms of health span rather than quantity of life. We need quality of life. And what you can do is to make your iftar tables, your everyday eating, including all these wonderful foods that are good for your health, good for your heart, and also very, very enjoyable. So half your plate should be vegetables, and a quarter of your plate, think when you eat a piece of chicken or fish, let it not be more than a deck of playing cards. That's like 3 ounces. And the rest of the plate, the second quarter of the plate could be your whole grain, or you can have your rice pulao with vegetables in it, to make it more interesting. So let's see how ready you are to make those changes for Ramadan or throughout the year. It's also important to think of children. Children come early. Parents bring their children, and they are hungry. So they begin to eat cookies. I see them eat cookies in the mosque. It's sometimes it's good to find out from these young mothers, if the host of the iftar can provide a child friendly meal, just one tray of something that the children will eat, enjoy, and also um, it could be helpful for them rather than sitting and eating cookies. I've seen parents bringing potato chips and giving it to their children because they're hungry. So I think we have to, otherwise, the parents have to bring some food for the children and not get them to eat just cookies and potato chips. So, um, and the traditions of our prophet praise moderation as a way of maintaining good health, and the Quran stresses the need to strike a balance between any extremes. So, we were talking before the webinar started, we were talking about how many people are hungry, not just in the developing countries, but right here in our country. Um, 41 million Americans face hunger, including 13 million children who go to bed hungry. There's food insecurity. So we can think of how we can plan iftar so that we can use that extra money to provide for food pantries or provide the food baskets that probably IMI is going to organize and has been organizing in previous years. Um, so there are ways of sharing whatever resource we have within our budgets so that we can have healthy food, but also be able to provide for those who don't have the food, even to meet the needs of Ramadan. So this is something we need to avoid, is not to overeat in Ramadan. It's very tempting, but if we all provide the foods that are helpful for us, so that all our friends in the community who are breaking the fast with us will also be provided with healthy food. So I'd be happy to take questions.
Right. Thank you so much, Dr. Vaida. First of all, this is such good information, and it's much, much needed for everyone of us to understand, before we just reach Ramadan. So, of course, you've explained so many things so beautifully, but we have some questions coming up from the audience. As you know, that hydration is one of the biggest concerns while fasting. So we have like few questions related to that. I'll just combine those together. One of them is that how can I ensure that I'm adequately hydrated through the fasting? And also, there's a question that if having coconut water is a good idea to stay hydrated.
Yeah, hydration is very important because you can end up in emergency room if you're not properly hydrated. So between iftar and suhoor is a time when you have to make sure you're drinking enough water or have beverages that don't have caffeine and don't have sugar in it. So you can, put some lemon juice in your water. That's fine. But continue to drink enough. And also make sure you wake up for suhoor. A lot of people miss suhoor, and that's not good either. So make sure you're drinking enough fluid and not having tea and coffee with the caffeine in it, because then you're going to get dehydrated. So if you're having tea, have caffeine free tea in the morning for the suhoor, but maybe but you can have the caffeinated tea in the evening, iftar time, because you can continue to drink enough water. With the question about coconut water, yeah, coconut water is fine. You can have it, but you don't. It does have sugar in it. You have to think of that, but it also gives you some potassium, which is good to have. So if you enjoy coconut water, that's fine, but make sure that you don't exceed that your blood glucose is going up. It does have some sugar in it. It has
Right,
calories.
right. So thank you. The next question is related to the same point that if one takes something, that might increase their blood sugar or, they're just trying to keep, for example, someone is diagnosed with diabetes type 2. So, and they are trying to balance their blood sugar throughout, the month of Ramadan. So, is there any like numeric digits that we should be aware of for a person who is a known diabetic, that this is, how much their fasting sugar should be? Um, if you can please guide us about that.
Yeah, there each one has to be treated individually. Your, the if your blood glucose goes above 100, it's you're in the pre-diabetes level. So it should be under 100, and between 100 and 126 is pre-diabetes. When it gets to 126 is diabetes. But when you want to avoid being at a very low level and having an episode of hypoglycemia, you have to watch. Should never be under 70, because that's an emergency, and then that's the time you break the fast. So you have to look at what your levels are during the year and how you're managing. Are you taking any medication? Are you taking shots of insulin? All that has to be managed with the help of your physician, so that you're in at a level where your blood glucoses are under control, and even postprandially, which means after a meal, like 2 hours from the time you've eaten, postprandial, 2 hour postprandial, to see what that is and whether it's in the range. All this has to be discussed individually with your physician or your nurse practitioner or your diabetes educator, so that they can help you to say, okay, you're in good control. And at the end of 3 months, you're going to have your hemoglobin A1C, and that gives you an average level of how your blood glucose has been over the past 3 months. So there are different ways of checking. Um, but during Ramadan, what's important is you shouldn't go over 300 or below 70. But you also have continuous glucose monitoring systems that will tell you in real time what your blood glucose is, and that's a very nice way of making sure you're in range and you're not going too high, or you're not going too low.
Right, right. That's very informative. One of the questions we have is the duration between the iftar and the suhoor. We already have a meal at the suhoor time and then at the iftar time. So the duration between these two periods, when we are allowed to eat, is it necessary to have something after every, few hours in that duration? To because some people have a target that we need to eat as much as we can during the time after the iftar and before the suhoor, so that while we are fasting we may not feel hungry. So is it a suitable thing to do, or would you advise otherwise?
Yeah, absolutely. As long you shouldn't have a big meal, very high in carbohydrate at iftar, because then your blood glucose is going to go up. So it's better to break it up and maybe 2 hours later have a little snack. Another 2 hours later, if you're waking up again, for your prayers, you can again have a small snack before suhoor. That's fine. You can have like two small snacks between iftar and suhoor. And in a way, that would be better for people, because then they won't have this excursions in blood glucose rise. You won't have a sharp rise. You'll be able to plateau your blood glucose levels.
Right, right. All right. And I know that you mentioned during your presentation already that olive oil is suitable to cook. But just for the awareness of the wider audience, I want to ask that as it is known in most part of the world that mostly recommended for high temperature cooking is the avocado oil, or maybe uh, some people also suggest ghee is an option to cook. But I just want to ask from the South Asian perspective that, when it is said that you can use olive oil for cooking as well, So do you suggest it for even the high temperature cooking or even, frying sometimes or not?
No, I don't recommend using olive oil for deep fat frying. No, you can use the oils that you have said. You can use those oils, even canola, avocado oil. You can use those. But again, none of these oils should be reused. People keep the oil and reuse it because when you're reusing these oils, you're going to oxidize them, and oxidized fat is not healthy. You can also have formation of trans fatty acids, which also are risky for your heart. So it's very important that you limit deep fat frying. Of course, occasionally people do want to eat your pakoras and samosas and whatnot, but there are ways of actually baking samosas. You should think of that. There's no reason why you have to deep fat fry samosas. But I guess for pakoras you do have to. But again, high temperatures are not recommended for anything. But occasionally, if you do, you do it, but you do take the risk. And the olive oil can be used for you know the temperatures which don't in a food that don't require high temperatures. There's no issue with that at all. I use it all the time for everything. Of course I don't deep fat fry anything, but I do use it in regular cooking and it's fine.
Right, right. And by regular cooking, we mean like stir frying something or even making some curry-based item.
Exactly,
Mm.
exactly, for all those things,
Right, right.
including scrambled eggs, whatever. Yeah.
Perfect, perfect. So we have another question that it's common to feel sometimes, lethargic while we are in the fasting state. Um, and some, people also get some symptoms like headache or, hunger is common, feeling thirsty is common. But are there any alarming symptoms, particularly considering the people who are maybe hypertensive or maybe known diabetes? Known diabetics, are there any alarming symptoms one should be looking at while they're fasting that, they should consider?
Well, you can monitor your blood. You can monitor your blood pressure. Um, you can check your blood sugar, and if you're getting a headache, maybe initially it's because of you're not getting the caffeine. So maybe you can start practicing a couple of this month before Ramadan starts, and see how you can manage with the decaffeinated tea in the morning so that you lower the risk for dehydration. So you can do the testing before Ramadan. That's why it's really important to have a program where you can talk to your doctor, test it out, see how it works for you. And if you're feeling lethargic because you're not getting enough sleep, everybody goes through feeling uncomfortable a couple of days, but it's just a couple of days, I think, from my experience, and then you get over it. But I think it's important to test it out before Ramadan starts.
Right, right. Perfect. We have another question that what is your opinion about having the food is steamed and being eaten, the steamed food instead of maybe cooking it in oil or maybe, deep frying it. How about the steamed foods to have in iftar and suhoor?
To have steamed foods,
Yes, yes.
well, if you enjoy it, it's fine. But we want flavors, right? We're used to so many flavors. So if you can do it, I think you can do it with a lot of foods. Like if you want to make some vegetables, or you want to then sprinkle some spices on it, you can do that. Sure, if you enjoy it and you can do it, you can make steamed sweet potatoes, which can be quite delicious. You can make them in the microwave to save time. Yeah, that's fine as long as you enjoy it, enjoy that kind of food preparation.
Right, right. So it's one of the healthy options that we have, is it?
Yeah, sure. And you can always use, to flavor it to bring. you need little fat to flavor foods. You have to understand that.
Right.
And if you're going to sprinkle some spices on it, you may want to use a drizzle of olive oil on it if you want to do that. Unless you really cannot eat the fat for because of a condition you have, and there are people who cannot have the fat. So for them, if you enjoy the steamed food, or you're just going to be cooking without fat, if you can cook in tomato sauce, in lots of vegetables, which give you the juices and the flavors, and 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 prepare the food that way, that works as well.
Right, right. So just connecting to one of the questions I previously asked, but because we have it from the audience, that do you have what is your opinion regarding having some kind of alkaline water or maybe Gatorade while the period we can eat or drink in that period to stay
There's
hydrated?
no reason, there is absolutely no reason to have it, because you're going to end up getting a lot of sugar from the Gatorade. Just water is great. If you want to add a little lemon juice to it, that's fine, or um, you know, just for the
Right,
flavor. Make some lassi with non-fat yogurt.
right,
That's great. You're going to get some protein. You're going to get the calcium. So that could be another drink between um, iftar and suhoor that you may. That could be one of your snacks that you have is a glass of lassi, and that will give you the fluid at the same time. Will give you some nutrients. But just the
right.
non-fat lassi is really fantastic to make it with the yogurt. Just add the water and maybe some toasted cumin seeds in it, or to give the flavor. It works really well.
Perfect, perfect. So because the month is just very around the corner, so everyone is more enthusiastic to uh, know more about it from someone like you as much as they can. So we have more questions coming up. So there's another one that what is the role of the fiber-rich food during a health in terms of having a healthy Ramadan diet?
Oh, the fiber is, there are two kinds of fiber. There's the soluble fiber that you find in like oats, in all the different lentils, dals, etc. And there is an insoluble fiber that you find in wheat if you eat the whole wheat. If you eat brown rice, it's insoluble. So both have play a huge role to enhance our health. So we have the soluble fiber that has an effect on giving a feeling of fullness. So you don't get that hungry. It also has an effect in lowering your bad cholesterol, the LDL cholesterol. And we have actually have done a study. We did it on Cheerios. General Mills gave me the funding, and we did a study to look at the effect of Cheerios, and we got a very nice reduction in 5% reduction in LDL cholesterol just by having 2 servings a day. So soluble fiber is good. So even if you're going to have oatmeal for suhoor, that will give you the soluble fiber. That will also give you a feeling of fullness, and it will also have a good effect on your blood glucose. You won't have it has sort of a effect on blunting the blood glucose rise. So eat the soluble fiber. The insoluble fiber is good for regularity. So if there's an issue with constipation, the eating whole grain fiber, whole grain foods is important. When you look at a label of breads or chapatis or whatever, make sure the first ingredient is whole wheat. It just shouldn't say just wheat. A lot of people think when they look at a label and it says it's wheat, it has wheat. Doesn't mean it's whole wheat. It has to say whole wheat. Otherwise, it's just refined flour, which is absolutely of no value other than giving you calories and carbohydrate.
Right, right. I'm sure our audience and including myself, we have learned a lot today from you, Dr. Wahida. And I would like to say a huge thank you for taking the time out and making us more aware for the sake of our own health in the month of Ramadan. Thank you so much for joining us and being part of this webinar today. Thank you. Um, if you'd like to say anything or give any final message before we
Well, I
close it.
wish everyone a very wonderful month of fasting. I'm actually writing a paper right now on the effects of religious fasting on cardiometabolic health. There's so much research on Ramadan. It's all very interesting, but it's not, it's all observational studies. People lose weight, but then they're not able to maintain the weight loss after Ramadan. And so there are a lot of issues. It's a good time to reflect, to feel good, at the same time, be able to help our fellow human beings by providing them with food as well, and watching our own budgets at the same time, providing healthy food. It's a good time for even for children, to eat in a community, to eat healthful foods. But I think it requires effort on the part of the host, on the part of the parent, to make sure the child is eating healthfully. Children are getting non-alcoholic fatty disease. I've seen that in little children, 10 years old, 8 years old, in our clinics. And it's because they're just eating the wrong food. They're sitting too much in front of the television, not exercising enough. So I think it's a good time to plan right now. We have almost half a month left, to see how we can, what foods to buy, keep it in our pantries so that we don't have to go looking for food and we are so too tired to do the food shopping. It's good to plan out the menus, and have a healthy eating style during Ramadan, continue for the rest of the year. It's been a pleasure.
Perfect. Thank you so much once again. And seconding what you just mentioned, that Ramzan is a month not just to think about our own selves, but to think and do something for the well being of our fellow human beings, inshallah. With that, I would like to thank you once again, Dr. Wahida Karamlly, for being with us today. And a huge thank you to the media team, Sarah Sharzadi, and everyone in IMI for organizing this webinar. Inshallah, see you again soon. Take care. Allah Hafiz.